How does DTTC therapy help with childhood apraxia of speech? Imagine trying to learn a new dance but struggling to coordinate your movements. That's similar to what children with childhood apraxia of speech experience. They know what they want to say but have trouble planning and moving their mouth muscles correctly. Dynamic temporal and tactile cueing, or DTTC, is a special type of speech therapy that helps children improve their speech skills. It uses a mix of visual, auditory, and touch cues to guide children through the correct speech movements. The therapist might show the child how to move their lips or jaw, listen to the sounds, and even touch their face to help them feel the right movements. The therapy starts with a lot of support. The therapist might help by physically guiding the child's mouth or face to produce the correct sounds. This is called integral stimulation, where the child watches, listens, and feels the movements all at once. As the child gets better, the therapist gradually reduces the help, encouraging the child to do more on their own. One key part of DTTC is practicing speech slowly at first. This helps the child focus on getting the movements right without rushing. Over time, the speech is made faster, helping the child learn the natural rhythm and timing of speech sounds. This slow start makes it easier for children to develop accurate speech movements. Research shows that children who use DTTC often speak more clearly and with less variability. Even children with severe speech difficulties can see big improvements. The therapy involves frequent sessions, often several times a week, to help children build their skills quickly and steadily. From a speech therapist's point of view, DTTC is based on motor learning principles. It emphasizes repetition, immediate feedback, and multisensory input. This helps children create stronger, more consistent speech motor plans, which are essential for clear speech. During therapy, the speech-language pathologist models words or phrases, then guides the child through the movements with visual and tactile cues. As the child improves, these supports are slowly faded out so they can speak more independently. Parents and caregivers are encouraged to practice with the child outside of therapy to reinforce what they learn. Overall, DTTC helps children with childhood apraxia of speech by targeting the core problem of motor planning. It uses structured, multisensory, and repetitive practice to help children produce clearer speech, communicate better, and gain confidence in their speaking abilities.